audience recognizes that this is a sacrificial endeavor, and the fact that you offer us such wonderful information, not just what we're offering tonight, but what other presenters are offering is really remarkable. Thank you again, David, for doing that. Tonight, my presentation is on vitamin D3, and I'm just going to begin with that. You know, vitamin D3 is being just voraciously studied out there, and there's lots of buzz about what's going on. And I've heard lots of different sides from the practitioner side, the physician side, researcher side. I've watched more DVD presentations myself and video presentations in the last couple of weeks. But I do know that there's lots of questions out there, and I hope that those of you that are on the call this evening will have some of your questions answered. Some of the things that you know, have come to me are, you know, is vitamin D really such a big deal? Does it prevent disease like cancer? Can it be used to treat disease like cancer? These questions and many more have arisen over just the things that I've been doing in the last little while. So I think that we'll try to clear up most of this evening, and I'll give lots of references. There's lots of places that people can go to take a look. So we'll do just a little cursory overview of the history. We'll talk about some facts about vitamin D3. I'll talk about diseases and conditions that appear to be affected by vitamin D3. And lest you think there's not a lot of research out there, there are at least 30 randomized control studies that are currently available, and there's at least triple that number that are in the works. So there's lots of information that's coming to the forefront. Then I want to get specific. Why are we deficient? Where can we get vitamin D from? Who's at risk, particularly? And then the bottom line is, how do we find out how much we really need and to determine how to supplement? And then I have a nice resource pages at the end. Most of my information, of course, is coming from other individuals. Dr. Narinder Dugal did a marvelous presentation a while back on building strength webinars, and I encourage anyone, if he's ever on, he's an excellent presenter. Dr. Robert Heaney is a respected D3 researcher. He's with Grassroots Health, along with Carol Bagley and Dr. Garland. Both of them are doing myriads of research in this area. Dr. John Cannell, of course, with the Vitamin D Research Council. So that's where I'm getting my information, and that's where I encourage you to get yours. And these people will be quoted throughout my presentation. I don't want to belabor the history. Let's suffice it to say that the road to discovery of vitamin D really did begin with the recognition that rickets was a very real vitamin D deficiency disease. The first formal medical written information on rickets was published back in 1650, so we can go way back to identify that disease. But during the Industrial Revolution, it was in the 1800s that the prevalence of rickets increased dramatically, and truthfully, amongst children, 40 to 60% of them that were crowded in polluted areas had rickets. In 1822 was the first recognized report. Then we got into the 1900s, where they identified vitamin D coming from cod liver oil. And also, in the same time frame, they identified that vitamin D was activated from cholesterol in the skin. Today, we have, starting in the 1980s, just a variety of studies and things that have culminated in our current position in the 2000s, where we now know that the research has come to fruition that vitamin D exposure through sun, through nutrition, is really important. And there are more and more people doing studies. I think one of the most prevalent studies was the 203 study that showed, and it involved 72,000 postmenopausal women. Of course, we at Help from Hormones and Let's Talk seminars don't talk about postmenopausal women, but menopause is the last era in a woman's life. So 7,200 menopausal women that took 600 IUs of vitamin D a day showed a lower risk in hip fracture. And that pointed to the fact that vitamin D was necessary for the absorption of calcium. So from there, let's talk about some of the things. Well, is vitamin D a fat-soluble? It is a fat-soluble, and it is considered a pro-hormone or a precursor to a hormone. Some are actually saying that it is a hormone. There's some talk as well that vitamin D may receive a second laureate Nobel Prize simply because it's being reclassified into another category. But recognize that vitamin D3 is stored in the body fat. It's absolutely imperative that cholesterol be present in adequate amounts to produce vitamin D. And so that brings up the whole question of, you know, what about taking statin drugs? We'll get into that in a moment. But statins, for those of you who don't know, lowers cholesterol. So there seems to be this division as to how much cholesterol a person really needs to have in their body. Vitamin D in and of itself is biologically inactive. It has to go through a certain process in the body. After it's consumed in the diet or whether it's made on the skin, it has to be converted in the liver to its active forms. I have a really nice chart later on that will talk about that. So a vitamin is an organic compound that is required just as a nutrient in small amounts by an organism like a human. A hormone, however, differs in that it is a chemical substance that's produced in the body and that it controls and regulates activity of cells and organs in that body. This is what qualifies vitamin D as a hormone. And so there, again, you know, people are uncertain as to what to really call it, whether it's a vitamin or a hormone. We're taking the position that it's at least a prohormone or a nutrient that expresses hormone activity. And there are a number of forms of vitamin D. The main form is, of course, vitamin D3. That's the form that's generated from the skin. Once it gets into the body, through the kidneys and through the liver, it's processed into two other forms of vitamin D. Now, vitamin D2, however, is a synthetic form. Ergocalciferol is a synthetic form of vitamin D2, and it is used in supplements that are by prescription. I want you to note that. I'll come back to that in a little bit. We'll talk about what's happening on the prescriptive front in the medical community. Here's our little chart. If you'll look on the left, you'll see that both ultraviolet B rays as well as diet can both add to the body producing vitamin D. But that vitamin D has to go through a couple of processes, through liver function, kidney function, in order to help with bone metabolizing, with absorption into the kidneys, and help with the parathyroid. It's important to note that there seems to be a great deal of discussion right now as to whether or not this absorption through the skin or through diet is the best source. And I'll be bringing up a couple of points on that later on in this evening's discussion. So there are some main functions of vitamin D. It regulates calcium and phosphorus in the blood levels. It helps to mineralize bone. We've known that one for a long time. It controls cell proliferation and differentiation. That's going to have a cancer effect or an anti-cancer effect. And it modulates the immune system. Some of these we didn't know before. And so understanding that the functions have changed a little bit. Dr. Cannell has been very good with this. Vitamin D then is the repair and maintenance man of the human body. So it does more than just build bone. When you think about it, of all the things vitamin D does, it usually works by repairing and maintaining the human body, says Dr. Cannell in his newsletter. And I would encourage on telomeres, and I wanted you to understand the information that is out there. But telomeres have a connection to vitamin D. Telomeres are those red regions at the end of a chromosome. they protect the end of the chromosome actually from deterioration. And it appears that for optimum health, the longer the telomere is, the better, the longer health that we have. Well, in addition to that, over time, because of cell division, the telomeres shorten. The telomeres are those disposable buffers then that block the ends of the chromosomes and are consumed during cell division, but then are replenished by an enzyme. Well, that enzyme, when it's deficient, is associated with aging, death, obesity, cardiovascular disease, depression, and diabetes. And guess what? There was a study done in October at the Georgia Health Sciences University that reported that vitamin D has a positive effect on telomerase, that enzyme activity. They gave 60,000 IUs per month. That's about 2,000 IUs, just under 2,000 a day for 4 months, to one group and a placebo to another group. Now, the problem with the study is that they gave people that 60,000 IU dose all at once. However, according to Dr. Cannell, the authors found that the vitamin D increased telomerase activity by 19%. The authors wrote, our data suggests that vitamin D may improve telomere maintenance and prevent the cells from deteriorating. Dr. Cannell raises an interesting point. I also wonder what the effect would have been if the subjects all took 2,000 a day instead of 60,000 a month. He said he felt that taking vitamin D over a regular, consistent time frame would probably have proven to even be have better results than just 19%. Interesting, though. Good research out there, and it influences kind of the latest in our DNA chromosome information. There are cofactors that are necessary for that vitamin D requires in order for it to be activated in the body. So first of all, our body has to have cholesterol. That's the main building block for all of hormones, and including vitamin D3. Then zinc, vitamin K2, boron, and a small amount of vitamin A are necessary. You know, if a person is eating vitamin A-rich foods or taking a vitamin A supplement, you should always make sure that you're getting some vitamin D with it, because these two work together. Now, not large amounts of vitamin A. We've learned just a tiny amount of vitamin A. But if you've got vitamin A and a multivitamin, you need to have vitamin D in there as well. Magnesium seems to be the most important cofactor. In fact, it's common for raising, you know, if you're going to raise your vitamin D levels and you're having a difficult time, make sure that you don't have a magnesium deficiency. So making sure that you have a little bit more magnesium in your body just might make that vitamin D be more bioavailable to your body. Now I want to talk about the difference between D2 and D3. This was brought home to me because my mother, who's 92, was being given a vitamin D supplement by her physician. And when I went into the interview with him, he absolutely confirmed that she was on a vitamin D3 supplement. And when we looked at her prescription, she was in fact on vitamin D2. A few things that I learned. Vitamin D3, again, is the one that's produced in the skin by direct sunlight or from cod liver oil, which is the preferred form of supplementation. Vitamin D2, however, is made by irradiating fungi and is definitely less effective. The case that vitamin D2 should no longer be considered equivalent to D3 is based on the differences in their efficacy at raising the serum vitamin D levels. And I think that it's important to note that D2, according to the American Journal of Clinical Nutrition, isn't suitable any longer, and there's really good support for that. If you have a look at this, this chart, we'll go back here, this chart, a single dose, 5,000 IUs, given
I'll call you back. Oh, folks, looks like
that vitamin D3. It appears that vitamin D3, when taken orally, dissipates more quickly than vitamin D that is produced on the skin when you're out in the sunshine. However, they've proven now that D2 dissipates much more quickly. And so you can see that D2, which is the prescriptive form of vitamin, may not be the best. I'll just add to that the doctor told my mother that she wasn't getting enough. Now, it comes in 50,000 IU doses, D2 does, and so he wanted to up her amount. We switched her to D3, and her normal values came up very nicely, automatically. So this is just another example of that study to show that vitamin D2 does not stay in the body as long as D3 does. All right, so let's talk about some of the health benefits.
Jackie?
Yes.
Right now, there's not a problem, but a couple of times.
Okay. Sorry about that break, folks. I think we're back. Jackie, over to you.
All right. There's lots of research out there on vitamin D3. So just be aware that if there's a supplement out there that says D2 on it, that's probably not what you want. There are more than 30 randomized control trials that are evaluating the health benefits of vitamin D. And as I said earlier, there's about triple that much ongoing that are evaluating as well. A recent study in the American Medical Association's archives showed that 75% of North Americans are deficient in vitamin D. Wow. I mean, that means that just about everyone on the phone tonight is, especially if you live if that's you, then probably you're going to be vitamin D deficient. That's a whole pile of us. The fact that in the world people have a vitamin D deficiency, even in the areas where there's lots of sunshine. Cloaking, will end up being a problem as well. People that cover up in the sunny, hot places will, and that's where we see in the hotter climates, we see still vitamin D deficiencies. Elderly are going to have a problem. Certainly menopausal women who are taking drugs for osteoporosis. If they don't have vitamin D, chances are there's a problem. And we're seeing that they have below 30 nanograms per mil. So that's considered very low. Let's talk about some diseases and conditions that vitamin D affects. Certainly rickets, and then osteomalacia, which is the adult version of rickets. And we all have seen women and men as they age, their legs kind of bow, and they develop that look. Do you know that the thing I learned today in my reading is that children in utero, little babies still in the womb, are developing rickets because the mothers aren't taking in enough vitamin D. So this is really becoming a problem. Certainly diseases like internal cancers, and we'll talk a little bit about those. MS, there's lots of research being done on MS right now, and there's lots of other diseases that are involved. Again, the main thing that would solve rickets would be some cod liver oil. But we're seeing a resurgence of rickets amongst not just African American babies, but amongst white American babies as well. So remember, if the mom doesn't get an adequate amount of vitamin D, there's a likelihood that her baby will be born with rickets. There are certainly bone diseases. We know that if you're taking calcium, Dr. Dougal's comment was no more than 250 milligrams of calcium, up your vitamin D anywhere he felt up to 10,000 IUs a day. most of us are probably going to get enough calcium from our diet. The problem then becomes how to get it into the bone, and vitamin D is essential for the absorption of calcium and getting it into the bone. So we know, and we have known for a long time, that bone diseases center around vitamin D. The problem was that that's kind of where everybody stopped, and we want to continue looking at beyond the calcium absorption, although that's important. Just keep in mind that most of you, if you're eating a healthy diet, lots of green leafy vegetables, nuts and seeds, that you'll be getting the right amount of calcium into your diet. What you're probably not getting is the right amount of vitamin D. So up your vitamin D, helps with calcium absorption. Don't over-consume calcium. I'm not going to belabor this, but there's no question that that taking in vitamin D promotes calcium deposition in osteoblasts. So it is a step in with osteoblast and osteoclast, which are the two major processes that take place in remodeling of bone. As far as cancer is concerned, we talked about the cell differentiation. We talked about the fact that it signals growth and stops growth. It reduces metastases of cancer this way, and it suppresses the gene that's responsible for cell proliferation. And of course, that ability to grow, multiply, and divide cells is what needs to be stopped in the human body. As far as internal cancers go, vitamin D was first suggested as a cancer risk reduction factor by, again, Dr. Garland in 1980. Now, Dr. Garland, along with Carol Bagley, work with Grassroots Health, and they're ongoingly doing research on various and sundry types of cancers, and they are really definitely to be commended. Now, they were the ones who noted that, for instance, there's an increased cancer for colon cancer mortality rate with the latitude. So the further south you go, the less people are dying of this form of cancer. Two studies, one on breast cancer, one on colon cancer, that sort of came to the forefront, both showed that vitamin D was going to be important if we were going to reduce our risk of these kinds of cancers. Now, there seems to be a discussion between staying in the sun and using supplements. And one of the things that Dr. Mercola brought up in his 1-hour presentation was that he believes that if you have a disease, say you had colon cancer or breast cancer, you would want to be out in the sunshine having your own body produce the vitamin D. If you're on a prevention program, his perspective was that you would take a supplement for a prevention program. A combination of both would be optimal, but if you want to reverse a disease, Dr. Mercola's suggestion was to get out in the sun. Arthritis as well. Almost 1 in 3 North Americans who are over the age of 45 years old will be affected by arthritis. That's a huge arthritis statistic. Goodness. And data has shown that osteoarthritis of the knee progressed more rapidly when people had lower than 36 nanograms per mil of vitamin D. The same was true with the study of osteoarthritis at the hip. Anything lower than 30 nanograms per mil appeared to produce negative results when it came to arthritis. Arthritis could proliferate when there was not enough vitamin D present. So these findings reveal that vitamin D actually has an impact on inflammation, and it actually has an immune response, even in healthy women. So the recommendation is for anyone who has a risk for arthritis of any form to make sure that you're taking an adequate amount of vitamin D. Colds and flus, because of the immune response from vitamin D, the thought is, are flu shots really as good as just protecting yourself with vitamin D? Well, flu shots have not been shown to be all that protective for huge varieties of people. And so I'll leave this screen up, but for you to think in terms of, you know, are flu shots really the best?
most of us should be taking an active approach by supplementing with vitamin D and starting, relatively early to prevent the flu by boosting our immune system, and that's what vitamin D3 does. One hypothesis that explains the seasonal nature of the flu is that influenza is a vitamin D deficiency disease, that the vitamin D levels fall to their lowest during flu season. And so when we look at the charts, that seems to be justified. December, January, February, March, November, December, January, February were the 2 times when the Hong Kong flu was at its peak. And so therefore, the hypothesis is that if your D levels aren't appropriate, then that's the time of the year that they will fall, and they won't be protective. The same thing is true for just generally for flu, December, January, February, March. So this is when we want to make sure that we supplement. In fact, our perspective has been make sure that you begin to evaluate how much you should supplement in the fall. Now, as far as the immune system goes, this is how vitamin D works. And it's always good to know how and why. Basically, it regulates T cells, which are your natural killer cells that defend your immune system. They act as an immune system modulator then, and they prevent the expression of these of the cells which are stimulating the cells in the lining of the respiratory tract, etc. But they stimulate natural killer cells that look after those cells. The vitamin D3 stimulated peptides play a major role in protecting a person from lung infection. So another reason to make sure, particularly if you tend to have respiratory problems in the wintertime, to get on some vitamin D. Vitamin D3 has a connection to depression and cognitive function. It would make sense if vitamin D is produced by the sun that there are some people out there who have sun deficiencies, that there could be a neurologic connection. Well, studies are showing that certainly with older people, older adults, Alzheimer's disease, even SAD disease, vitamin D3 will alter or impair, if it's not in adequate amount in the body, cognitive performance in elderly people. Well, I can say that it probably is true for everyone if it's true for just the elderly. Another study was based on data from almost 2,000 adults over 65, and their cognitive function was assessed. The study found that as level of vitamin D went down, so did cognitive impairment. Now, I think that this is very, very important, and that people who become depressed in the winter should take a real strong look at this, and perhaps make sure that, number one, you're getting more sunshine in the times of the year when it's prevalent, and then secondly, make sure that they're supplementing with an adequate amount of vitamin D. It stands to reason then that seasonal affective disorder, or SAD disease as it's called, has a vitamin D connection. And so there's a number of research studies that are pointing to that. That is pretty much confirmed. If you have seasonal affective disorder and live in a climate where you only have, say, 3 or 4 months of summer sun, you will want to be supplementing for sure. Autoimmune diseases like lupus, for instance, there seems to be a connection. There's an immunoregulatory or an anti-inflammatory property that is being attached to vitamin D, and so we don't even know all of the autoimmune diseases that it affects, but I know that there are studies on lupus right now, some studies on rheumatoid arthritis, and certainly diabetes. But it will go on and on. MS seems to be another one that's very prevalent. Studies are being done. I have a cousin who has a daughter who has lupus, and I know that they've never considered that she could be vitamin D3 deficient. But we have to think in terms of how much are we out in the sun? How much vitamin D is your body being allowed to produce? And if you're not supplementing, why not? I want to raise the point of MS. How many in the audience know someone who has MS? How many have heard that vitamin D very likely reduces the risk of and the symptoms of MS? I bet there's hardly anybody in the audience that's even heard that. Well, that's because this is not being, it's being studied right now, but the medical community really aren't addressing this as an issue. But this is an issue. There are an estimated 330,000 North Americans that have multiple sclerosis. I mean, it's a chronic debilitating disease that affects the brain and the spinal cord. If you've ever met anybody with it, it's sad. All of these statements are true related to MS. There's a genetic component to MS risk, with Northern Europeans being at the higher risk end. That means the farther north, the higher the risk. You are 5 times more likely to get MS if you live in Europe or North America than those who live in the tropics. The prevalence for MS is twice as high in the U.S. above the 37th parallel than below. Again, north of L.A., higher prevalence for MS. Exposure to the sun before the age of 15 decreases the likelihood of developing MS. How many moms sunbathe their babies? I mean, sunbathe is almost a word that we don't use anymore, and yet we need to be thinking in terms of bathing in the sun again. Norwegians who live along the coast have a lower risk of MS than those who live inland. And okay, we've never had this kind of problem before.
We haven't, Jackie. It's bizarre. It really, really is bizarre. I apologize about it. I don't know why.
All right. So I will pick it up. All of the statements that are true, I'm going to pick it up from there. Okay, so MS, it's interesting to note that those in the UK with skin cancer were found to have half the rate of MS of the rest of the population. Now, that's interesting. Now, again, we don't want anyone to develop skin cancer because of sitting out in the sun too long, but they don't seem to get MS. So I wonder if that's a direct relationship. MS prevention by vitamin D. And this is, again, Dr. William Grant, PhD researcher, suggests this. I estimate that 40 to 70% of MS in the U.S. could have been prevented through adequate vitamin D, especially in the winter. This is a season when infectious diseases are most common. MS appears to be caused by infectious disease. Circulating vitamin D levels are lowest in the winter. So I think that it's real important for us to listen to these folks, to what they're saying. There's a lot of diseases. I'm not going to go into, the list goes on and on and on, I'll be very honest, but muscle pain and weakness, including fibromyalgia, the progression of rheumatoid and osteoarthritis, both type 1 and type 2 diabetes seem to be affected positively when vitamin D stores are highest. Seems to have, vitamin D seems to have an insulin connection, make the receptors more susceptible to insulin and stop the insulin blocking. The body-brain disorders during fetal development, irritable bowel, Crohn's, high blood pressure. Interesting to note that if you are on the call and you have high blood pressure, one of the easy protocols to embark on would be to take some vitamin D. Make sure you do a test, find out what your vitamin D is, and address it from there. But truly, the list is developing. It's getting bigger and bigger and bigger for what diseases are affected by vitamin D. So the question that everyone on this call needs to ask is, am I deficient, and if I am, why? I think the main reason for a deficiency is because our society has changed from working primarily outside in an agrarian agricultural type of lifestyle to almost spending most of our waking moments indoors. That certainly is true of children in this generation. I was outside playing a lot more than my grandchildren are. There seems to have developed a fear of the sun, and that fear is that it will cause skin cancer. Well, apparently, when I was a child, we used to call vitamin D3 sunshine vitamin D. And parents would tell us that if you started to turn pink, that you should go in and cover up. And I think that's probably a really good idea as well, to get back into suggesting that. The sunshine and nutrition are the main ways that we can access vitamin D. And if Mercola is right, Dr. Mercola suggests that the vitamin D that we get from the sun as we sunbathe is really more and better for us than the supplement. Then we've got to change our attitudes and not fear the sun anymore. All right, so sources of vitamin D. UVB radiation. Do you know through a window, a window in a car will block UVB radiation. UVA gets through, you can tan, but the B radiation doesn't get through. And so that's the part that produces the vitamin D on our skin. So it's important to, to get outside away from windows. Dietary sources, fish, very good. There, of course, are lots of foods that are fortified with vitamin D, and certainly supplements of vitamin D. There seems to be an ongoing debate about sun lamps and tanning lamps that mimic the solar UV rays, and so tanning beds are kind of coming back in again as perhaps a way for some people to very gently increase their vitamin D stores. Scientists estimate that as much as 25,000 IUs of vitamin D can be produced with full body exposure to the sun within an hour before our skin turns pink. In fact, your skin turning pink seems to be the main signal that your body has to cover up, that for that moment in time you've had enough sun. But your body takes in a huge amount of vitamin D. Here's the kicker, though. You have to expose your body, your whole body. So it's not just your arms or your face or your upper shoulders. The idea is to sunbathe, and that means probably for most of us getting into a bathing suit or even less clothes than that and getting out into the sun for full exposure. For those up in the northern part of the United States and Canada, April, May, and June, well, April, May, June, July are our strongest, possibly August. We have about 5 months of time when we can be exposed. The rest of the time, even if we were out in the sun, it's not going to produce enough vitamin D because the sun isn't strong enough. Now, again, tanning bed exposures seems to be coming back with wisdom. I think it's probably not a bad idea for those people with SAD disease, and perhaps for those who are just not able to get out on a regular basis, or for those who live in the north. You just want to be wise about how you use a tanning bed. 30 minutes of exposure will produce 50,000 IUs of vitamin D in lightly pigmented people, and that's a critical issue. So there's many types of skin out there. The darker the color of the skin, the less vitamin D is produced, and the longer that they have to stay out. So you want to be thinking in terms, if you're a very fair-skinned person, you don't want to stay out very long. Sunscreen, and this is something to note, sunscreen, even of a mild SPF 8, decreases vitamin D production by 95%. So basically, the suggestion here is that when you go out in the sun, you want to be doing a small amount of your sunbathing without any skin sunscreen on your skin at all. Otherwise, your body isn't going to be able to produce, it blocks enough that your body isn't able to produce vitamin D. Interestingly enough, that chronic sun exposure amongst outdoor workers at the end of the summer equated to levels of 28 to 5,000 IUs per day. They've done studies with lifeguards as well, but a lifeguard is out there virtually unclothed for long periods of time, 8 to 10 hours a day, in order to get their sun exposure, and theirs only came up into the 5,000 range, and no one had excessive levels of vitamin D at those ranges, which was interesting to say the least. So you know, a big mistake, according to Dr. Sam Schuster, was the idea that sun exposure causes melanoma. They went public before that was proved. In fact, we don't know what causes melanoma. And it's interesting to note that indoor workers seem to have a higher rate of melanoma, skin cancer, than outdoor workers. And so the research is ongoing there. But please don't be afraid of spending a small amount of wise time in the sun when we have sun. Otherwise, we're going to be having to supplement. So where do we find that sun? Well, north of LA is the 37th parallel and north. This is where they believe that the deficiencies of vitamin D begin. So recognize that if you live north of that 37th degree latitude, you know, probably we're going to be deficient. And even, I would just say, for some of those who live south, if you're experiencing smog or pollution, or you don't sit out in the sun because it's too warm a climate, then you're still going to be vitamin D deficient. All right, so let's talk about where we get vitamin D from. Sun should be number one, according to Dr. Mercola, and I would agree with that. That's the natural way that our body has of producing vitamin D. Food sources are important as well. There are fortified foods as well as foods that are known to come with a vitamin D intake. Probably one of the reasons the Eskimos do so well is because they have, you know, a plentiful supply of cod liver oil from fish. Salmon is good. If you're drinking milk, if you're eating cereal, you know, some of those, but notice the degree. Cod liver oil is still the best source if you can get your children or you to take it. Sunshine is still the best. Excuse me. Who's at risk? Well, this is interesting. Anybody who's homebound. You know, I would classify most of our children today as homebound individuals. If they're not in school, they're in the house in front of the television, and believe me, the television isn't the right kind of UVB rays that that you want to have exposing your children to. Living in the North American latitudes automatically predisposes us to limited sunlight. Wearing clothes, cloaking, for instance. Women who wear cloaks every time they go outside, excuse me, are going to have a problem. Working in occupations that prevent sun exposure, anyone who works in an office, anyone who works in a school, you know, where you're spending the majority of your day inside, it's going to be problematic. People with dark skin pigmentation, it takes 5 times more vitamin D on your skin in order to bring the levels up. Elderly who don't go outside. Infants, even babies in utero, are going to be vitamin D deficient if their moms were vitamin D deficient. So pregnant women could be in this classification as well. And I want to go through each of these as well. A deficiency is considered to be less than 10 nanograms per milliliter. That's an insufficiency then is between 10 and 30. And I put the Canadian equivalent in brackets beside it. Between 40 and 80, somewhere between there, is considered to be the best place. Now, you know, Dr. Mercola, just using sunshine, tries to keep his at 150 nanograms per mol, and he's trying to prove that it's not unhealthy. But he's at the right end. We're going to keep middle of the road here. 40 to 80 nanograms per mol seems to be exactly where we should be. Now, for bone health and other conditions, of course, a little bit higher, getting it towards 90 to 100 might be where we ought to be. How do we figure this out? Well, this is a really good chart that is actually in one of our newsletters. If you go onto our helpforhormones.com website and click on vitamin D3 testing, go in 2 times at the bottom of that, you'll find a newsletter. And this chart is printed in that newsletter. So if you want to have a copy, on the left side is the U.S. nanograms per milliliter, and nanograms per mol on the right is the Canadian evaluation. So from 60 and above seems to be where all of us should try to aim. How much do we really need? Well, you know, if you work outdoors and have considerable exposed skin and don't use sunscreen, you may not need to supplement. But I think that we can pretty much recognize that the majority of us are going to have to supplement in order to get the amounts up to what it should be. 500 IUs per day for 2 months is our rule of thumb, and then obtain a test at the end of 2 to 3 months. Test, don't guess. Adjust your dosage so that the levels are between 40 and 80. And that's the US one, 125 to 200 in the Canadian one. And again, we recommend adequate vitamin D for 2 months, then test. We think that that makes a lot of sense. Now, we have just come out of summer sunshine. We're into the fall. If you were to test right now, it would also tell you how much you need to supplement. And we think that's important as well. Once you have been in the sun, if you think that you got enough, then test. Find out what that should be. Now, there's no toxicity with the sun because your skin deepens in color. For those of you with all but one type of skin that doesn't color with the sun. But your skin color deepens with the sun, and that's the body's way of protecting you from overproducing vitamin D. 1,000 units per day at the lower end of a realistic therapeutic intake for someone with limited exposure. 2,000 units IUs a day is what the Food and Nutrition Board says. 1,000 units per day total body sun exposure easily provides the equivalent of that, and this is what's being suggested by doctors like Dr. Dougal. And again, you know, our recommendation is, you know, if your test shows that you're low, then remediate somewhere halfway in between, maybe 5,000 IUs or even 10,000 IUs a day, only for a limited time, 2 to 3 months, and then test again and see how fast it's brought up. One of the studies that has come out most recently by Dr. Garland shows that everybody is absorbing calcium at a different rate. So we can't say for you on the phone call that absolutely, if you take 10,000 IUs of vitamin D per day, that in 5 months you're going to be up to normal. We cannot say that. Some people will, a lot of people won't. Probably the majority won't. And so it takes a lot more vitamin D, we've discovered, to raise the levels than what they originally thought. So the idea of reaching a toxicity level is almost non-existent until you get to doses of over 5,000 IUs. This is a great study. They gave adults 4,000 IUs for 5 months, and they only got their levels up to 40 nanograms per mil. And remember, we want it 60 to 80. So that gives you a little bit of an idea of what we're faced with here. With 67 men were given a higher dose, and 5,000 IUs and 10,000 IUs, and they saw no toxicity. The 5,000 IU group reached 60 nanograms per mil, which is right in the range. 10,000 IUs averaged around 90 nanograms per mil, and that's still not considered toxic. So, and still considered, you know, probably where most people want for very good health. Dr. Cannell, who's the president of the Vitamin D Council, suggests that nearly all cases of toxicity came from the pharmacological doses of vitamin D that resulted from D2, because they gave the doses are such high amounts. So again, watch for D3 and D2. It's D3 that we want. If the bottle that you're taking doesn't say, don't use it. This was the toxicity test that Grassroots Health did. They are in the forefront right now of, and it's grassrootshealth.org if you want to go on. They are in the forefront of doing all kinds of research. They have a breast cancer study right now that a few women on the call might be interested in participating in. But basically they showed no toxicity at 10,000 IUs a day or less. And I think that that's pretty significant. And they evaluated a lot of people. So they're really in the forefront of doing the most research right now. So what about a test? Well, the basic way to evaluate vitamin D levels is through blood. And doing a 25-OH vitamin D test is the way to test. Now, some people you can go to your physician and requisition that test, and your medical may pay for it. For those in Canada, the Canadian government has opted to not test every single person in the population, not allow it to be covered by medical. So we offer the tests through Labrix, and it's a very easy test to do. It doesn't take very long. You know, the item, I think Dr. Jeffrey Dack put it plainly, in terms of getting more bang for your healthcare buck, vitamin D testing and then supplementing if you show to be deficient for the population is one solution that's guaranteed to improve all overall health of the population at a ridiculously low cost. And that is the truth. Vitamin D is very inexpensive. And to be able to test and then determine whether or not it's your supplementation is effective, I think is very important. Testing is easy. There's an instruction booklet, just a little prick of your finger, and you get test results that tell you how many nanograms per milliliter of blood your vitamin D3 levels are at. And it's nice and easy to read, quick and simple, doesn't take long. Your test needs to reach the lab within 7 days. That's an important feature of this test. And here are the ranges. So, you know, if you're dosing at 5 to 10K, retest in 3 months. If you're dosing at 5K, you can give it 6 months. If you're only dosing at 2 IUs, then, you know, 2,000 K per dose per day, then 6 months, every 6 months test until you reach normal level, and then you'll be able to discern from there. One thing that we at Help for Hormones do is we provide access to a consultant to review your report and to explain the findings and assist with the next step. I know that sometimes reports to us look very simple, but you know, if you need some assistance, we would be glad to help you. Every person who contacts Help for Hormones and orders test kits from our website receives an opportunity to talk with one of our trained consultants, and even if it's just to ask some questions, by all means. You know, even after a thorough presentation like this, some will always ask, do I have to supplement? Well, I think that it's pretty plain that the majority of us probably aren't getting enough. But if you have a traditional Alaskan diet, you'd have to consume salmon, seal, whale at every meal. How does that sound, and is that your plan? So cod liver oil is on the agenda if you're not willing to supplement any other way. And we have produced a supplement that we think is superior. A sublingual spray, the delivery system under the tongue, really gets the nutrients into the system very quickly. I think that using a vitamin D3 spray is a great idea. It's just a small tube that fits into a purse for a woman, and it's nice and easy and effective way to supplement. It's more rapid than taking a pill. It avoids, because it misses the first pass by the liver again, gets to the receptors that it needs to get to. It's easy to take, and it doesn't taste bad, and so even children will appreciate this. 5,000 or 500 IUs is one spray, and 4 sprays a day is 2,000 IUs, which would be a good maintenance level for the majority of people. And because of cofactors that are necessary, our Daily Max supplement that contains green leafy vegetables and the vitamins A and some of the cofactors that are necessary would be an excellent complement to that. Because vitamin D is so cheap and so clearly reduces all-cause mortality, I can say with great certainty vitamin D represents the single most cost-effective medical intervention in the United States. And these are medical doctors who are coming to the conclusion that, you know, it's important. Vitamin D is cheap, and it's going to have a profound effect on people's bodies. Now, the issue for you and I to decide is how much of our vitamin D are we going to take in through the sun, and how much are we going to take in through supplementation. Dr. Robert Heaney, in his presentation, summarized his report this way: vitamin D deficiency is a worldwide problem. Even countries where it's hot, they're not going out in the sun, or they're cloaking. It involves all ages and all races, right from in the womb to the day that we die. Rickets is on the rise in the womb as well as in young children in the United States and in Canada. Prevention and treatment is inexpensive. It's easily implemented. In fact, I will say this about that. You know, Dr. John Lee, who I had the privilege of being mentored by, often said when you can put the prescriptive process into the hands of the person who's going to receive the improvement, that's the best thing. So you can test yourself and you can prescribe for yourself, because vitamin D3 is not a drug. My summary is this: vitamin D, I believe, is essential for optimal health. It's essential for hormone health as well. And remember, the body uses it in so many processes that it will affect a variety of symptoms that men and women are experiencing out there. There's no question that the sun ought to be our primary source for vitamin D. Plan to get out in the sun more when the sun is in your locale. If you are not able to do that, then you're, you know, in the absence of UVB rays, then supplements are going to be the choice. But to maintain an optimal level of vitamin D is important. And certainly to select a good quality supplement, something that's easy, something that you're going to do on a regular basis. And again, sun lamps and tanning beds may not be as bad as what they're made out to be if and when they're used wisely. So if you're asking yourself, so what do I do next? Well, you can do one of two things. You can order a test right away, and then you're testing what you took in for over the summer. Or you could start a D3 regime, taking, say, 5,000 IUs a day for the next 2 months, and then test to see how quickly your body is absorbing that vitamin D. Again, everybody's absorption rate is a little different, and once you've tested, either way, you'll adjust your dose with a goal of correcting your deficiency. Our newsletter, by the way, gives really excellent information and for ongoing information if that's what you want. So I believe that vitamin D deficiency is a choice. You and I have the tremendous ability here to test and to sit out in the sun or take a supplement or eat foods that are high in vitamin D. Basically, if it's going to be, it's up to me. Adopt that policy. Test kits are available from us if you want. Supplements are available from us. If you want us to work with you, we'd be glad to do that. We're always looking for consultants who are interested. They would be both practitioners and lay people who are advocates for balancing hormones for men and women. So I'll leave that with you as well. You know, there was a study that was published in the Annals of Epidemiology conclude that supplementation with vitamin D could prevent approximately, listen to this, 58,000 new cases of breast cancer, 49,000 cases of colorectal cancer in North America each year. Moreover, blood vitamin D levels at the time of diagnosis for breast and colon cancer is highly correlated to survival. In other words, the higher the vitamin D, the more chances that they remain living. So I hope that I brought to your attention tonight the need to consider vitamin D3 testing and supplementation. Both are very, very important. And if I've done that, then this presentation is a success. I encourage you to let your journey for more information about vitamin D3 not stop here, but continue to pursue this information, because there's lots happening in this field. And keep your eyes and ears open. By all means, go to grassrootshealth.org and to John Cannell's site, the vitamindcouncil.com, and start plugging into some of these great resources of information that are out there. All right, I think it's time. I don't know if anyone has any questions, but is there anyone out there that would like to ask a question?
I think we have a couple. So, folks, if you like, go ahead and type in your questions in the top right-hand corner of the screen. There should be a floating panel there you can use. Jackie, excellent presentation. Excellent.
Well, thank you.
Okay.
This is probably, I learned the most, David. You know that.
You learn the most
I always do.
From preparing for it, right?
A couple of things really stood out to me this time as I was reading the new research, because I spend a lot of time going back over what I did before and what's new.
Right.
One of the things that has come to the forefront are young children who are easily bruised and bones easily break are often, when they're taken to the hospital, the parents of those children are under almost attack. It is thought that that those children have been abused. Dr. Cannell has been working with a group of parents for whom, they were great parents. What they discovered is that those children had low vitamin D stores and probably had been at birth. And to find out that children are born with rickets. And that the shaking baby syndrome, parents who shake their babies, the shaking baby syndrome wouldn't happen if vitamin D levels were higher.
Really?
It's just sobering what's really out there.
My goodness.
I know. So
right.
I'm out to change my world. What can I say?
Well, it's a big kudos to you. I mean, we need more people like you doing that. And folks, the fact that Jackie is, what an excellent teacher. And those of you who are considering being a consultant with her, I really urge you to take that next step, because she just has a wealth of knowledge, and she will hold your hand and really show you how to be an effective consultant and help other people the way she has been helping people for the past, how long now, 20 years now, Jackie?
Yes, just 20 years.
Yeah, 20 years. My goodness, 20 years of good work.
And I'm still learning. Every day of my life I read something about hormones. And this whole vitamin D thing, I can remember I had a nurse call me from Saudi Arabia and asked me, she said, you've got vitamin D in this and in this supplement. Do you think it's too much? And it wasn't even 1,000 IUs. Now that's about 15 years ago, but...
Well, I mean, I had the family. She had a friend of mine. She had 10 kids, and a couple of the kids came down with the flu. So I took vitamin D over to their house, and she was petrified of going above 1,000 units. Yes. Petrified.
So we really have come a long way, haven't we?
Well, it's still not far enough. I mean, educated people are still afraid of going above 400 international units, because that is what is still conventional wisdom, that the dose for vitamin D is 400 units a day.
Yeah.
Which is so, it's almost ridiculous how low that is compared to what we should have. All right, so did I get you right? Okay, a couple of things I want to bring up before we start asking questions from the audience. So what they're finding out is that most skin cancers are not actually caused by overexposure to the sun.
That's correct. They now have come to the conclusion that they don't really know what causes melanoma, that it isn't overexposure to the sun, because the most, in recent research now, this is in the last, say, less than 5 years, the largest number of people with skin cancer have not been exposed to the sun. Remarkable.
Oh, my God.
Well, and then there's a whole group out there that believe that the chemicals that are in sunscreens are problematic as well and could be one of the causes for skin cancer as well.
Yeah,
so
I've
if you're
heard that.
applying those very heavy chemicals to your skin all the time,
yeah, I've heard that too.
so you know you want to be real careful with what's in the sunscreen. Half the time you can't pronounce the names of the ingredients.
Right, right.
So not only does, you know, and let's face it, then if vitamin D exposure can do all these other things, it probably helps with skin cancer. And so here we've been blocking the nutrients that would help us prevent skin cancer all along. Now, we're not talking about sitting out there and burning our skin. You know, I mean, when we were young, you know, we did some crazy things. I remember putting baby oil on our skin and tanning. Well, that's crazy. The idea of sitting out there till your skin is pink and then covering up. Interesting. Now, David, because of your skin color, you need to be out in the sun 5 times longer than me.
Well, yeah, that's not going to happen, especially now when it's so damn cold outside now.
So for you, the only option is a supplement.
Right. Right.
So, and that's you know what we're seeing out there now. For me as well, even though I have a fairer skin, there's no sun here. I'm reigning in Seattle. You know how that goes. So we all have problems. You know,
yeah.
I think it's true. Even if people live in LA, David, you know, the smog, the sun doesn't filter through all that.
Right, right. Yeah, so it's just ridiculous if anyone's saying that, well, I just get it from the sun. Because I think it's plain Russian roulette. Or
Yeah,
is it roulette or roulette? I don't know.
Either way. Roulette sounds very classy.
It sounds classy. It's true.
So do we have any questions?
We do. Okay. Question 1, is polysorbate 80 a toxin in some circumstances? Oh my goodness, that's technical. Do you know what polysorbate 80 is?
No, I don't.
Okay. Harold, you're going to have to help us here. All right. This week, a medical doctor on a TV program said that excess vitamin D can cause heart problems. Is this so?
Well, that's not what the research is showing. So, you know, again, there are 30 randomized controlled trials that have been completed, and there's triple that amount on the go. All they have to do if they want to really look at this is go on to, you know, Dr. Cannell's vitamindcouncil.com and grassrootshealth.org and look at the research. You know, it's for each one of us now, David, to make our own decision on this.
Right. I totally agree. But that's just ridiculous, any doctor mentioning that heart problems. Okay. Well, then again, maybe he's referring to vitamin D2, and he's probably just lumping all of them together in the same classification.
Well, and that's a possibility. Although it is vitamin D2 that the doctors. I mean, my mom's doctor didn't realize that she wasn't getting D3. The doctors are ignorant of that information because the way they've marketed it as vitamin D, and they didn't, sort of separate the two at one time. Now they're going to have to. But if a physician is not on his game and not understanding that, he's not going to know the difference. Why would he think that the drug that he prescribes wouldn't be the right one?
He's not going to check it out. I mean, you're probably 1 in 100 who actually decide to take him to task for that.
Well, and I didn't, David. I have to be honest. You know, I'm not an in-your-face kind of person, believe it or not, with the medical community. I have many friends who are physicians. I didn't take it up with him. I switched my mom.
Really?
And within 3 months, her levels were up to norm. Well, they were going to up her D2, and she was already taking lots.
Mm.
So I haven't taken it up with him yet, but I will.
Fine. Okay, what is the dosage for young people?
They say 1,000 IUs for children. Dr. Heaney has a really good sort of position. 1,000 for children, 2,000 IUs for teens, and adults 5,000 and up. Pregnant women, a minimum of 4,000 for pregnant women.
4,000, got it. I mean, when Elizabeth Owens was on, she and Dr. Pendergast were like anything less than 10,000 is ridiculous. They're not even doing anything.
Well, the thing is that we're talking to people who may not test, okay? So if you're not planning on the call to do a test, then you stay at the lower level, because there will be no way to know how they're absorbing. See, when Elizabeth did that, Dr. Garland hadn't done his research that shows that we're absorbing vitamin D at all different levels. So you cannot actually say, like, some people will absorb it faster and others won't. The majority still are not absorbing it fast enough, even at 10,000 IUs. But if you're going to decide to take 10,000 IUs a day or give that to your family, you better be testing every 2 months until you reach normal level.
Right.
You see, so that's the perspective. Fine, it's good to take upper levels, but you have to test. So there's a bit of a price to pay for the test.
Makes sense. Okay, when someone is taking vitamin D3 supplements and has gone down in the serum vitamin D3 levels, what other factors could be causing that?
Probably look at their magnesium level.
Okay.
Remember, the cofactors are necessary. I would take a look at that person's diet. I would make sure that their nutrition program in general. I mean, a supplement is still just a supplement. We still want to have the cofactors. That's why cod liver oil seems to be very good. There's something else in it that, provides a good base.
Right.
And I would say, seek the sun. Maybe try a tanning bed.
So a tanning bed does help convert vitamin, your skin converts.
Provided we have enough cholesterol in our body, as long as they're not on a statin. And so that I would bring up that point. As long as that person's not on a statin that's lowering their cholesterol, then vitamin D absorption should be good. It should work. Right amount of magnesium, making sure that you have good nutrients in your diet. But magnesium's an important one. Both my husband and I, because we've upped our vitamin D3 for the winter now, we've both increased our magnesium intake. We're taking, I think, 250 milligrams of magnesium. It's not a lot, but it's just enough.
Okay. All right. Cheryl says, great job, great presentation, Jackie. So, Shalavchuk.
Yes. She's a
Back it up.
Yeah.
Shalavchuk. Okay. Tough name. Okay, Cheryl wants to know, I'm interested in vitamin D3 and in how it would work for arthritis.
Well, Cheryl, I share that interest because, of course, I have osteoarthritis in my knees, as my identical twin does, too. Our orthopedic surgeons, one lives in Toronto, one lives in Vancouver, and the Toronto gentleman asked if we got our knees at the same time. Of course, David, we're identical twins, right? So here we are. We have osteoarthritis. So I'm maintaining pain-free. I did 5 flights of stairs yesterday at an arts council thing. The elevator broke, and we had to walk up and down 5 flights of stairs, and I did it twice.
Oh, wow.
And I had no pain in my knees. Now, it's only one of the nutrients, but I am taking 10,000 IUs a day. And so I'm really focused on making sure that my vitamin D levels get into the optimal range for whatever is happening. And if Mercola is right, David, and he says for prevention the supplements will work, if you have a disease, like if I had breast cancer, I'd go sit in the sun.
Yeah, but if there's no sun to be in, I mean, you have no other choice, right?
There is in the Caribbean, I heard.
Okay, well, Jackie, not everyone has $1 million like you. You take a break on vacation and go to the Caribbean.
I haven't been able to do that, but then I'd go to a tanning bed.
Okay.
There's one, you know, hook or by crook, there's a way to get it.
Okay.
We just, you know, there's always a price to pay, right? Whether it's a cruise or you know, a place on the beach, or whether it's pay for a tanning bed or pay for eating a pill.
That's true. And our goal with these webinars is to help people find the best.
Or what works for them. You know, I'm not going to dictate what their method is, but there is an availability. My goodness, vitamin D3 is the cheapest nutrient on the planet right now, and it's readily available.
Yeah.
You know, it's made from lanolin, hey?
Lanolin?
Lanolin. It's made from lambs, from sheep's wool.
Oh, okay, gotcha.
And I don't think sheep are still pretty plentiful on the planet, so it's not likely going to rise in price.
Who knows? Well, that's true. And so I apologize for saying your name was difficult. I have a very difficult to pronounce last name as well, so I solidarize.
Well, not a problem, and we rarely have this kind of difficulty, so we'll leave it at that. And there, you know, whatever, you know, if people want more information, our website is up and available. And again, as always, I appreciate this. Maybe we'll get together and we'll talk about hormones and heart health coming up, so because of the question about cardiovascular disease. You know, it might be appropriate in February to do something on heart health and hormones.
Right.
We'll bring in vitamin D. How's that?
Absolutely. That would be a great idea. That would be a great idea. Okay. And I know there's just a couple more questions coming in, so they can just send you questions.
Sure.
Okay. Okay. Well, let me just ask Joan from Australia's question. Okay. Have you been exposed to the sun and then go in and have a shower with soap? Does this wash the vitamin D off?
No.
Okay.
No. Because vitamin D is produced in the cholesterol that's beneath the surface of the skin.
Okay, got it. So the soap does not go that far down. Okay. Okay. Perfect. Well, that's great. We made it through in spite of all the technical difficulties.
All right. Well, and hopefully we'll do this again real soon.
Absolutely. As always, Jackie, I really appreciate you all putting so much time and effort and good information down for us.
Very good. My pleasure.
All righty.
All right.
Folks, thank you, folks, for joining us. You have a great evening. MP3s, we now start making audio files of these, so it will be available. And of course, members always have access to these on the site for free. God bless.